So von Hippel Lindau can have two specific signs. The first one is isolated involvement of the pancreatic tissue with multicysts, as you can see here. Multicystic involvement of the pancreatic tissue. This patient is 37 years old, female with hypertension and abdominal pain. And images showing no involvement of the liver or any other organ, no involvement of the kidneys with these cystic lesions. So the isolated involvement of the pancreas can be a specific sign of von Hippel Lindau disease. The principal diagnosis here is von Hippel Lindau disease, and these lesions called pancreatic cystoids of von Hippel Lindau disease. The differential diagnosis is autosomal dominant polycystic kidney disease, where the pancreas, both kidneys can be involved. The management here, you need to refer for discussion at hepato biliary MDT, and also you need to consider genetic testing. So in this case, you need to consider genetic testing for von Hippel Lindau. So this was the first sign of von Hippel Lindau. So what is the other sign? The other sign of von Hippel Lindau is the development of multiple haemangioblastoma. So multiple haemangioblastoma could be a sign of von Hippel Lindau disease. This patient is 17-year-old boy presented with headaches. So as you can see, this is an example of haemangioblastoma. There's a posterior fossa lesion. You need first to mention the level of the lesion extending from the medulla to the upper cervical cord at the level of C2 level, at C2 level. Then you need to mention that the lesion is intra-axial and arising from the posterior aspect of the medulla, as you can see here, arising from the posterior aspect of the medulla, and then the content of the lesion. The lesion is mostly cystic, showing the CSF signal intensity, low signal on T1 and a high signal on T2, with a solid component or a solid nodule, eccentric and basal, with an eccentric and basal solid nodule, which shows heterogeneous signal on T2, heterogeneous high signal on T2, with flow voids at the peripheral aspect of the lesion. Flow voids at the peripheral aspect of the lesion. These are the flow voids at the peripheral aspect of the lesion, indicates that the lesion is a very vascular lesion. These lesions will show two signs of hypervascularity. The first sign is here. Without contrast, you can see the signal voids at the peripheral aspect of the lesion. And after contrast, the lesion shows avid post-contrast enhancement. The solid component shows avid post-contrast enhancement. Okay, so you need just to mark this avid post-contrast enhancement. Okay, as the flow voids on flare sequence Both of them mean that the lesion is avascular. So in the interpretation, you need to mention there's a vascular neoplastic lesion arising from the posterior cranial fossa. Okay, the principal diagnosis here is hemangioblastoma. Also, you need to mention that the lesion causes mass effect, exerts mass effect on the lesion, exerts mass effect downward and upward, exerts mass effect on the caudal aspect of the fourth ventricle if facing it. Okay, okay, so this lesion is causing effacement of the fourth ventricle. Okay, and downwards you'll see that there's evidence of T2 hyperintensity centrally in the cervical cord, as you can see here. T2 hyperintensity centrally in the cervical cord. Okay, um, and on the diffusion weighted sequence, there is no evidence of restricted diffusion, so it's not medulloblastoma. So in these cases, you'll find that an added diffusion weighted image sequence should be added. So you can exclude medulloblastoma. Okay. The principal diagnosis here is hemangioblastoma, and the differential diagnosis, as I mentioned, medulloblastoma and the pilocytic astrocytoma. The management here, um, when you refer the patient, you need to think first this lesion, how it will be possibly treated. I think it will be surgically resected by a neurosurgeon. So the patient needs to be referred to for discussion at neurosurgery MDT. Okay, a neurosurgery MDT. And also, you need to consider genetic testing for von Hippel Lindau disease in a case of if there's evidence of multiple lesions. Okay, so you need to consider genetic testing for von Hippel Lindau disease. That's it.